Imagine a medical treatment that works on paper but fails in the lab. The reason might not be the chemistry, but the clock. Testing a compound at the wrong hour can ruin an otherwise perfect study. Dr. Randy Nelson at West Virginia University focuses on this specific intersection. His research proves that internal biological clocks shift baseline physiological parameters like immune function and metabolism throughout the day. These metrics are in constant flux over any 24-hour period. This chart illustrates what happens when those cycles are broken. Artificial light at night disrupts the internal rhythm, skewing experimental data and triggering neuroinflammation that changes the biological baseline. Because a subject's physical state undergoes extreme shifts throughout the day, asking the exact same experimental question at noon versus midnight often yields opposite answers. Time of day functions as a decisive biological variable, a factor dictating the scientific truth of an experiment. Nelson is applying this methodology in the intensive care unit, where his team is running clinical trials with patients recovering from stroke and cardiac surgery. Hospitals are notoriously chaotic, so the intervention is precise. The team blocks the disruptive effects of artificial overhead lights at night. This allows the patient's biological clocks to regulate, potentially improving recovery outcomes. They are also running a parallel trial outfitting night shift nurses with bright blue light visors to safely reset their own internal rhythms. These interventions target specific improvements in their sleep quality, their cognitive performance, and overall mood for staff. Translating that foundational biology into clinical practice shows exactly what is at stake. Overlooking a single variable like the time of day can stall a promising experiment or delay treatments that save lives. Despite its massive impact on outcomes, the time of day is rarely reported in scientific literature. It is an almost universal omission. This chart shows the systemic result. These missing variables create a valley of death for research. Thousands of foundational studies enter the funnel, but get blocked by methodological blind spots, leaving only a trickle to reach clinical medicine. When complex variables are not explicitly reported, it destroys the reproducibility of the research globally. Other scientists simply cannot recreate the exact conditions of the original test. Right now, an early career researcher or a dedicated PhD scholar is likely making these exact methodological errors without even realizing it. Brilliant hypotheses are consistently derailed. Not because the idea is weak, but because the isolated researcher lacks rigorous outside methodological review. The root cause of these errors comes down to institutional limits. Academic researchers are frequently forced to work in total isolation. Today, modern science demands deep, interdisciplinary collaboration. Yet many scholars simply do not have access to strong, experienced supervisors within their specific niche at their home institutions. Asking a colleague down the hall for informal advice is no longer sufficient. You need specialized expertise to navigate complex data pipelines, machine learning models, and incredibly strict publication standards. The lone genius model is a myth. Surviving the modern peer review process requires structured, expert partnership. Research Decode serves as a dedicated digital safety net, built to align academic ambition with the rigorous execution required for professional achievement. Their flagship eSupervisor program provides structured, one-on-one mentorship from domain experts at premier global institutions like IIT and IISc. These eSupervisors step in during the critical early stages to help researchers refine their initial questions, assess feasibility, and establish bulletproof methodologies before a single experiment even begins. This interface shows the depth of specialized technical support available on the platform. If you are working on predictive biological modeling, an expert can guide you through complex statistical analyses, like calculating the exact probability for a compound to be active. This systematic engagement model monitors every milestone, providing a layer of expert accountability from the initial research question to the final thesis defense. Beyond mentorship, the platform features a collaboration network. Here is a direct request to collaborate on fMRI data analysis, instantly connecting projects across disciplines. Through these connections, researchers share datasets, validate workflows, and cross-reference results to eliminate methodological blind spots. Ultimately, this support helps scholars process their findings into manuscript-quality output and develop effective journal publication strategies. The real-world outcomes are measurable. Users have taken completely stalled dissertations and pushed them to submission in just months, earning credible mentorship endorsement letters along the way. You no longer need to let institutional limits dictate your success. Work with experts, finish with confidence, and start your partnership today at researchdecode.com.